Thank you everyone for being here today. We are part of the panel discussing community-specific research during COVID-19 in Austin, Texas, collaborations and community experiences with food insecurity and food access issues. Some more information about our panelists. My name is Catherine Janda. I'm a postdoctoral fellow at the University of Texas School of Public Health here in Austin. We have some representatives from the University of Texas at Austin's Dell Medical School with Casey Hansen and Mariana Espinosa, who are sharing some incredible work that they've been doing with the Central Texas Check-In. And then we'll be going to Dr. Sandra Vandenberg and Aida Nielsen, who will be presenting some findings from the COVID-specific work with the Fresh Austin study. And all of these different projects will help you kind of contextualize some of the data that we have been gathering during the COVID-19 pandemic and leveraging existing relationships, partnerships, and data sources that we have in order to get some COVID-specific data within the Austin region during the pandemic. So I will go ahead and get started. So first, I'm going to be doing a background on food insecurity and food access. I know given this conference, there's probably been some of this information that's already been shared, and we might all be on the same page, speaking the same language, but just in case, we're going to do a brief overview and also talk about some of the 211 call data analysis that we did during the pandemic. So a little bit of context, food insecurity and food access in Austin has been an issue since well before the pandemic. Prior to the pandemic, 11.8% of American households identified as food insecure in 2017, and they're an above the national average prevalence of food insecurity within the state of Texas, with 14% of families in Texas identifying as food insecure between 2015 and 2017. And within Austin, it's above not only the national average, but also the state average, with over 15% of families in Austin experiencing food insecurity in 2016. And again, this is all obviously pre-pandemic. We also know, for those of us in this region, that Austin-Travis County is a fairly diverse area. Just under 50% of residents identify as white. Over a third identify as Hispanic, about 8% as Black, and close to 7% as Asian. And residents of the eastern crescent of Austin are more likely to have experienced limited geographic food access and food insecurity issues. Partially and in large part the remnants of structural racism and practices such as redlining and other factors that have historically and systematically underserved areas and within this region. We also know that there are various health conditions and unhealthy dietary behaviors that are associated with food insecurity and limited food access. Therefore, rising rates and prevalence of food insecurity and more issues with food access is a severe concern and a public health issue. So that leads us to, what about during COVID? Early projections from Feeding America believe that there could be 17.1 million more Americans that could become food insecure due to COVID-19. And Census Pulse survey data estimated that food insecurity prevalence in Texas more than doubled from 2019 to November 2020, from 14%, and then it went over 28% back down to 27.9%. More recent data in June 2021 show that it's still above that 14% number, and that is actually at about, it was in June 2021 at about 22.4%. We know anecdotally that many experienced issues with food access due to store closures, lines at food banks, individual level factors such as increased potential risk for contracting COVID-19 due to medical history, other health issues, etc., as well as a variety of other factors. However, most recently in the last couple of months, USDA released a report that included national food insecurity prevalences and stated that food insecurity apparently did not increase, and it stayed at 10.5% from 2019 to 2020, which is, spoiler alert, a little bit of a contradiction from what we've heard from more regional data. And we wanted to know, how is this experience happening locally during the pandemic? So I had a background of using 211 call data with my dissertation, which was defended at the very early stages of the pandemic in April 2020. And we had a strong collaboration with United Way for Greater Austin and their 211 call navigation program. For those of you who aren't familiar with 211, 211 connects callers to resources in their area, and a caller can call about any issue, and 211 will try their best to connect them to various resources that are proximally located within to their home and wherever they are based. We have previous experience using 2018 211 call log data to identify areas with food needs and limited geographic food access with this map right here that represents the 10 county service region of the United Way for Greater Austin, with that star being downtown Austin. So this methodology became super relevant and important during the pandemic, and we wanted to make sure that we were able to identify areas with unmet food needs due to COVID-19 in Travis County. So collaborators, including all the people on this panel, were instrumental in making sure that we tried to look at this issue and examine it from a variety of different perspectives. So with this 211 call data, we were able to analyze data between January and August, and then October through November 2019 and 2020. September is missing because there were some issues with the line maintenance during that time. And so the data was not necessarily the most accurate, so it was not included in the analysis. Calls were categorized by call reason, with an emphasis on food need related calls. So food need related calls included any type of call to 211 about a food bank, a food pantry, supplemental nutrition assistance programs or SNAP, pandemic EBT as that became available, and other food insecurity related issues. Every call had the zip code of the caller, and so we were able to incorporate that into our analysis and create some maps, as well as the food access locations during COVID-19. Emergency feeding sites and food access locations were provided through connectatx.org, and they were able to do a great job of providing us with up-to-date information about where was open, where was closed every single month. There was also limited demographic data. This is a weakness within this analysis, but Health and Human Services of Texas make it so it's not allowed to ask about race ethnicity within 211 call data. So that's a weakness within this, but we try to kind of remedy those weaknesses in other analyses that will be presented by other partners. And then the key point of this work was that this work would then be shared with various stakeholders and inform program implementation and policy. So to dive right into the results, you can see the total call volume to 211 by month for January through August and October, November 2019 in the lighter blue and 2020 in the darker blue. You can see that it increased during the pandemic, was higher during the pandemic than 2019 for that month, with the exception of August. And that big peak in April of over 9,498 calls to 211 just from Travis County was largely driven by food need call volume, which you can see in this graph. You can see that every single month during this study period, there was a higher food need call volume in 2020 than 2019, but there was much larger differentials during the pandemic related months. We also analyzed this statistically and did paired t-tests and found that there were significant differences and increases in food need call volume in 2020 than in 2019 during this study period. Also, this big peak in April was largely due to SNAP information requests. We also were able to categorize calls for a variety of other reasons, and those include finance and unemployment, health and mental health issues, housing, transportation, utilities, and other reasons. You can see that in every single month, food need related call volume and health and mental health related call volume were the number 1 and 2 highest reasons for calling. And that is super important when we think about and how to contextualize these co-occurring needs with food insecurity and food access as we continue with this presentation. So we also wanted to analyze these findings geographically. So what that meant was that we were able to map them, and I'll share some maps from some of the reports that we developed, but we found that call volume was highest in that eastern crescent of Travis County for overall call volume as well as food need call volume. But we wanted to see the proportion of food calls within the zip code. So that way you're not comparing a more rural zip code to a more urban zip code that would have a super high call volume, to see kind of how those issues were being were occurring within the county. We also created maps demonstrating the change in percent of food need calls in 2020 versus 2019. So here's a map that was included in one of our numerous reports that we created for November 2020. And you can see the proportion of food need call volume is depicted kind of with this heat map type of coordination and categorization, and the dots are the various different emergency food access sites that were open during that month. And you can see that it's a much brighter narrative in this eastern crescent of Travis County. These kind of dark burgundy colors, while they look very alarming, had a very low call volume. So they weren't as necessarily as the food needs weren't necessarily as prevalent there as in other parts of the county. You can also see that change in percent of food need calls in Travis County by zip code during the study period from 2019 to 2020. So you can see that these more scarlet regions are a 10 to 20% increase in food need call volume in 2020, and these darker colors are those more than 20%. So you can see that that eastern crescent was really heavily affected by food needs during COVID-19. So what are the policy and practice implications? We were able to provide recommendations for placement of emergency food assets in 2 zip codes and to closely monitor additional zip codes that have emergency food assets but may still have unmet food needs. This led to 1 zip code receiving an asset in September 2020, so a very rapid translation of research to policy and practice. This methodological approach can also result in timely turnaround for much needed community-specific data, which can often take years and often multiple years to develop. It also has tremendous potential for scalability given the prevalence of 2-on-1 programs throughout the country. And it also was super helpful in being able to share these data with our partners at the City of Austin, at Dell Medical School, at obviously United Way, and other collaborators and partners. So that way we could kind of have a sense of what was going on at the ground level. So with that said, I'll turn it over to my colleagues from Dell Medical School.
Good afternoon, everyone. I will go ahead and get started. My name is Casey Hansen, and my colleague Mariana Espinosa will pick up where I leave off. So thank you, Katie, for the nice handoff. Just want to start out by saying that this really was a collaborative effort in that the data that the School of Public Health was able to provide, even about those zip codes, really helped us to then push out a survey that we call the Central Texas Check-In into some of those neighborhoods to get some household level information. And that's what we'll be sharing with you today. Next slide. So just a little background around why we were even invited to the table. One of the things that we do in our division, we work in the Division of Community Engagement and Health Equity at the Dell Medical School in the Department of Population Health. And so one of our roles really is to leverage opportunities with partners, assess social determinants of health, and then also try to connect folks with resources. So we, in this role, do not play, we're not service providers in any way. We're not even providing medical care, but strictly, trying to do a public health effort in places where we know there are potential medical needs. All right. So one of the original works that we started in 2017 was an initiative called a Household Level Assessment, which we affectionately call OLA. And it truly is a household level person data collection methodology. This work actually led to Austin Public Health asking us to help connect people with resources who were COVID positive at the beginning of the pandemic, because our household level assessment work clearly got shut down once the pandemic started. And that work then led to partnership with UT School of Public Health and the City of Austin. Next slide. So a little bit about our survey, and then we'll kind of dive into the data. So First off, we did the survey in 2 different languages. Our goals were really to establish trust in the communities in which we were going into, also build upon that trust, and then ultimately connect people to resources. The time frame was fall of 2020, and the city actually asked us to reach out to very specific populations because they, again, wanted some quick data in order to make some informed decisions about where to go next during the pandemic. So you'll see those priority populations there. And just for context, because we were in the midst of the pandemic, and we did our survey electronically, and we pushed it out through community partners via email and text in order for them to push things out into the communities that we felt like clearly were the priorities there. Next slide. So our sample, which I have to say out loud, was not a representative sample. We were very targeted in those populations that we wanted to reach. And so we did not, try to get a representation from different zip codes or parts of town. We were specifically trying to hit Eastern Crescent populations. And so we got about 758 total survey responses. So that represents 758 households. 91% of those are from Travis County, and then we had 9% out in the other counties. The age ranges were between 20 and 96, which was great. We wanted to make sure that we got folks in that older population. The mean age was 47, and then you can see the percentages of seniors, English speakers, and Spanish speakers. Next slide. So this also just gives us a breakdown of our race and ethnicity. So that darkest kind of orange reddish column is our Latinx population. Right next to it is the white population. The black is kind of that yellow mustard kind of color. We also wanted to reach Asian populations, and we didn't do a great job of that initially. We did wind up circling back to that population, but during that first cohort, this is kind of how the breakdown showed. Next slide. So now we'll dive a little bit into the results, and I'll take these first couple of slides and then pass the mic to Mariana. Next slide. So one of the things that we just want to be clear about is one of the methodologies that we use when we ask people questions, we want to make sure that we can point folks to resources. And so one of the things that became very evident very early on is that there were inequitable access to resources in these 4 areas. So we looked at food insecurity, housing stability, employment, and healthcare, okay? And what we found is that there were some noticeable differences between different populations. So those who were homebound, let's say our older population, who was a priority, non-English speakers or non-citizens, those in large families, so maybe multiple generations, and then clearly in our BIPOC populations. And one of the things we also noticed at this particular time is that while people, folks who might have been used to accessing resources in various ways, we got a lot of information from people who didn't know that even 211 may have existed, or how to get on Connect ATX. So our role was truly to be the bridge to resources in these 4 main areas. Next slide. So one of the questions that we asked just about services and resources was, what services or resources do you need for your family at this time that's due to COVID-19? And we did ask some questions about prior to COVID. So this particular part of our questionnaire was specific to what resources you needed right now. And you'll notice here that our top 3 here are food, cash, utilities, and then we have to add on rent because it's very close. So those were our top 4. You'll notice that none was in there. So people did have the opportunity to tell us that they were doing very good. And so we did have that as well. Next slide. And you'll notice here the breakdown by percentages for those top 5. So I've already mentioned those. And then Katie kind of mentioned this earlier, that we noticed this co-occurring need. So we had a range of about, from 0 to 12 needs. The average was 2.1. So people were identifying multiple needs at that particular time. About 25% of households selected 2 to 3 needs, and 23% selected 4 or more needs. And so when you think about someone needing food, transportation could also be closely connected to that. So we'll dive into kind of some of those results a little bit later. Next slide. These are just some quotes that I want to just share quickly here. Again, making those connections, and then I'll pass it on to Mariana. One person said, we asked the question kind of how this was impacting their family. Folks said that, you know, they were tight on money, and so they needed money to pay for rent and food. We know that folks were having a hard time finding employment, and they recognized too that there were systems in place, but it was very difficult to make those connections. And so again, we felt very validated by the fact that we were there to help people get connected to resources. And then the last thing too, that we can't over or under emphasize here, that it was very difficult for some who were, you know, trying to get through their immigration status to get the help that they needed, because they didn't want it to impact their immigration status in any way. And so those were things that people shared with us, and we're really grateful that they were vulnerable enough to even to share that at that time. And I will stop here and pass things over to Mariana. Next slide.
So I'm going to talk about some other data points that we collected in the survey, and then kind of summarize this and pass it on to my colleagues. So one of the things we surveyed is food needs, which is super important. We're here at a food conference, right? And so I wanted to make this emphasis that, you know, one of the things that Casey mentioned is that food was like one of the highest needs that people identified. I think it was like 29% of people in our survey identified food as something that they needed in that moment. We also asked some other questions about food. So this was, you know, answering yes, no, somewhat. And so people who were asked if it's more difficult to have enough food in their household, or if they were worried about food running out, that was 52% of our survey population. So about half, a little over half of our survey population, again, targeted in, you know, Eastern Crescent, BIPOC populations, older people living in that same area, were saying that they had problems accessing food. 75% of those people who said, yes, I am having trouble getting food, were not white. 72% had suffered some sort of income loss at the household level. So they had lost their job, or maybe they were furloughed. And then 75% said, when asked directly, is your financial status better, worse, the same? 75% said that they were worse off than before the pandemic. So we can kind of see how everything here is cyclical. It's connected to each other. It's not isolated. Next slide. And then, as Casey mentioned, we looked at services that were provided both before the pandemic and after the pandemic and did a comparison. So this is one of the comparisons that we looked at, is folks receiving SNAP, meals from school, accessing food pantries in their community, and getting WIC. And as you can see, there's a really sharp incline in people getting SNAP and people getting food from the food pantry. School meals are about the same, WIC's about the same. One of the reasons we believe there was that sharp increase is because of PEBT. Now, if you remember, the pandemic EBT started shortly after, you know, we went on restrictions of, you know, business closures and things like that to restrict movement and prevent the spread of the disease. And so pandemic EBT was released, and in the summer months, people were enrolling in PEBT in 2020. And so this probably has something to do with that. And it's nice to know, too, that a lot of people were accessing the food pantry, because we know that a lot of people had food needs during this time. So the food pantries were there, they were serving the community, and the community knew that they could go to them. And then, you know, just looking at the total numbers, there was a jump from 41.7% to 62.5% of people accessing these types of food assistance during the pandemic compared to before the pandemic. Next slide. And again, you know, this is some of the qualitative data that we collected from our surveys, just to give you a flavor of what people are saying and what their needs were and how everything is connected. So, you know, some people said that it was hard to get transportation to the food banks, or it was too far to even go to the grocery store. So some of those folks who are in geographically isolated areas They noticed the prices of food going up, which is, still happening even now. And, some folks were just on that cusp of not qualifying for certain benefits. And so they were in a bind because they felt that financial strain, but they couldn't qualify for benefits in order to relieve some of that. Next slide. So one of the other areas we looked at is housing. So 25% of the people we surveyed, or households we surveyed, were not able to make full rent or mortgage payments on time. And of those, 13% received eviction notices, 65% of those were Latino, and 46% were Spanish speaking. So we're looking here at a difference in responses based on certain populations, certain demographic characteristics. What is interesting to note and should be obvious is that 100% of those people who weren't able to make their payments on time had suffered some sort of income loss at the household level. Again, they may have lost their job, they may have been put on some sort of restriction because of someone at their work having COVID, so they were unable to work for a certain period of time and their income went down. Next slide. And here's some of that qualitative data that I think really brings some richness to the survey data that we collected, the quantitative data. So one person said that they would love to get help with rental assistance, but they asked so many questions, demanding information, and not just rental assistance, but they need help with utilities and gas and electricity too. Another person said that, during this time when everybody's stretched financially, that instead of their rent going down, it actually increased. And they didn't have enough money to, pay some of their bills. And that person wasn't able to work because of the type of job that they have. Another person said that their credit cards are maxed out, they don't have any savings, and they're worried about being homeless. So this is like really serious stuff, right? And a lot of people are just a paycheck or two away from being on the brink of, a financial disaster in their home. So I think this highlights that. Next slide, please. So this is about work and employment. We asked about people's financial status. Like I mentioned earlier, 56% said that they are worse off than before. 47% of the household surveyed lost their job or had hours reduced. That someone in their household had lost their job. And then 53% said that someone in their household had a loss of income. So they may not have lost their job or had their hours reduced, but could have been in quarantine or some situation like that where they were unable to work for a certain period of time. And so that blue area is the good part that we want to see. Is like nobody in their household is impacted negatively. But then that leaves a little over 50% of the rest of the survey population that was impacted in some way financially. Next slide. So one of our surveyed household members said that their pandemic unemployment assistance ran out, and I told them they were okay. They were okay, but now they're not. Another person talked about being a single mom and how hard it is to have to work less hours because their children are at home with them and still pay the same amount of bills. Another person talked about how difficult it was to get unemployment because they were a contractor type of worker. And, just like a lot of people we know, there's when you have less money coming in, but a lot of expenses, it's just hard to make things work. And they said that they wish the city could help them more. Next slide. So I'm going to wrap this all up and then pass this along to my next presenter. Next slide. So one of the things that we really wanted to highlight was kind of this like cyclical issue that's going on from someone being exposed, whether that's the individual in the household who is working or not. And exposure at some household, like some member of your household, means that you have a quarantine in your home. If it's someone in your work, that means you have a quarantine. If there's someone that is at school, potential quarantine. So there are so many reasons that someone would have to quarantine, right? And then that means that that person's unable to work. then they're bringing in less income, and it makes it difficult to pay for necessities. So that's something that we heard in lots of different ways over and over again. What is important to highlight too is the thing that Casey mentioned at the very onset, is that there are multiple co-occurring needs. The needs aren't really occurring in isolation. Someone often doesn't need food and nothing else. They often need food and help paying for rent or utilities or childcare or something else. And speaking of childcare, that was the concern for many to be able to work and get to the resources that they needed, to be able to pick up free resources that were being offered. You had to have that flexibility in your schedule, and also the transportation to get there. And then the other thing that's important to note is that a lot of services are provided with the assumption that your household is small, like, for a household size of 4 or, 3 or 5. And I'll say a lot of the households that we surveyed had 8 people living in them, or multi-generations living in them. So I think that's something too, that when we're providing services to the community, we have to think about is, what really is a household. Next slide. And then when we talk about barriers to access, there are so many different types of barriers. So what we found, or what we uncovered from people asking them about, kind of the experience they had during COVID, not just physical access or being distant and not having transportation, but also information access. So we asked, and we didn't present this data, but we asked about what modes of information are you receiving and receptive to? And a lot of people were saying that they were getting their information from social media, but a lot of the information about services being provided wasn't being transmitted that way, or they said word of mouth. That was something that we discovered from the follow-up survey that we did on the people who spoke languages other than English and Spanish. A lot of them were getting information by word of mouth. And so we know it's really important that if we're going to provide services, that we do it in a way where the people who are needing those services can actually learn about them and get them. And then, we did learn about some systems and infrastructure and capacity issues. So some barriers to being able to apply for services because you don't have a certain identification, for example. Or, they try to get a hold of a certain, city office and just couldn't get through to anyone and had long wait times and gave up. And then finally, immigration status. It doesn't matter if you've done all the paperwork or you haven't. If you're not a citizen, there are some barriers to getting help. And like one example, the stimulus checks, when it was first rolled out, that folks were able to those. If your household, both partners in the household didn't have a social security number, which is not something that you get right away when you first immigrant. Not everybody's able to get that right away. So there's lots of barriers like that we uncovered to access. So it's just good to keep those in mind. Next slide. So what we recommended from looking at all this data, and again, we are reporting our data to the City of Austin, to the Sustainability Office in Austin Public Health, and then also the Emergency Response Group, is just to have a holistic examination and coordinated response to address these issues. So everything's kind of rolled out in isolation. That doesn't work a lot. That doesn't work really well for families who are strapped on time, transportation, money, resources to get to the services that they need. So having resources coordinated all in one spot is super helpful. Anticipating and minimizing those barriers that we mentioned, receiving assistance is always good. So, we provided detailed information about how to minimize those barriers so that when people are trying to access services in the future, they can actually get them and know about them. And then, of course, continuing to collect data so that we understand the people that we're trying to serve. Next slide. And I mentioned this earlier, but these are the folks that we shared this data with, just so we can continue to work together in the community to respond to the needs that are happening because of COVID-19. Oh, next slide. I think that's it. Yes. Now I'll get to
All right, before I start, I want to make sure that my sound is okay. Can y'all hear me okay and it's not staticky? Okay, good. So, good afternoon. My name is Sandra Vandenberg, and I, along with Aida Nielsen, sorry, will be presenting some data that is very similar to what Mariana and Casey presented, but dives a little bit deeper into food insecurity and people who were newly food insecure versus people who were food insecure throughout before the pandemic and then after the pandemic. So to give you a little bit of background of how we came about doing this study, I need to tell you a little bit about the FRESH study. So in 2016, the city of Austin provided about $500,000 in annual funding to implement a comprehensive multi-sector healthy food access initiative, which was called Fresh for Less, to improve access to fresh, affordable, and nutritious food in mostly like the Eastern Crescent here in Austin. 3 different nonprofit organizations were involved: Sustainable Food Center, FarmShare, and Engava. And they were the agencies that actually implemented the different strategies. Next slide, please. To evaluate this program, Sustainable Food Center applied and then received a grant from the Foundation for Food and Agricultural Research. And then they subcontracted with us, the UTHealth School of Public Health, to actually do the evaluation. And in addition to that, develop an agent-based model to predict healthy food purchasing and consumption. So the overall purpose of the evaluation was to see how this initiative that these 3 organizations were implementing changed people's behavior in terms of food purchasing and food consumption. So the original plan was to create a cohort of community residents living in the Eastern Crescent, 400 people or households, and then follow them over a 3-year period. So this was started in 2018. So that's when we collected our baseline data. Then we collected our year 1 data in 2019. And then in 2020, we kind of had to pivot because everything changed, right? The strategies that were being implemented were no longer happening because we were not supposed to be, because the gatherings were prohibited in Austin. So we pivoted as well, and as opposed to following that same cohort for 2 more years, we created a new cohort, kind of a cohort, based on the original cohort, but and followed that group of people over a 2-year period. And the idea here was that we were really interested to see how people living in low-income communities that already were experiencing a limited access to food, how were they accessing food during the pandemic? So we created a new survey, which we call very original, the COVID-19 survey. And I think it's in the next slide. We administered that survey at the beginning of COVID-19, so around April, May of 2020. And then again, about 6 months later, it's November and December of 2020. Then in addition to that, and this is what Aida will talk about, is we did some qualitative interviews with a portion of those people to just get more in-depth information about what we were seeing in the quantitative data. So I will be presenting some of the change or some of the data that we found during the surveys. So first of all, I just want to mention here that we had a food insecurity screener because we were very interested in changes in food insecurity status during this time. And we found that, that we had about 46% of people who stayed food secure throughout the entire study. Then we had about 19% of people who became newly food insecure during the pandemic. And then we had about 35% who were food insecure before and then during the pandemic as well. So very similar to what Mariana and Casey found is we had 54% of food insecure folks in our sample. So kind of going back to what Katie was talking about at the very beginning, that the USDA kind of reported that there were no increases in food insecurity during the pandemic, we found very different results. We actually saw pretty steep increases. Just want to say, just give you some more specific data about our sample. It was very diverse. We had about 64% that was Latino or Black, 60% were families with children, 44%, so almost half, either lost their wages or had a reduced income. About 44% also changed their regular food shopping location due to food access related issues. More than 50% had issues with food availability. And again, Mariana also mentioned these things. 68% reported that there were increased food prices, so more difficulty purchasing food. We had an additional question of kind of like measuring food resiliency, asking them how much food they would have, or how long could their food that they have available in their home right now last. And most, 65%, had less than a week of food available in their home. Next slide, please. So again, what I mentioned earlier, food insecurity rose from about 30% in year 2 of our survey, so right before the pandemic, to 52% during our first COVID survey. So we were able, like I mentioned earlier, classify people in 3 groups: people that stayed food secure throughout the whole entire period, people who became newly food insecure, and then people who were consistently food insecure before and during. So we were interested in looking at different characteristics, right, of the people that became newly food insecure. So compared to people who were food secure the entire time, people who became newly food insecure, they were more likely to have children in their households. They were more likely to have lost a job or wages. They were more likely to report changing their usual shopping location, were more likely to report food availability issues, and they were more likely to report that they had less than a week of food in their home. Now, we also compared the people who were consistently food insecure to the food secure participants, and they had the same factors that were different, but in addition, they were also more likely to be Latino or African American. So those were the consistently food insecure folks. When we looked at behaviors, again, our original purpose of our study was to look at food purchasing and food consumption behaviors. We found that people were less likely to purchase fruits and vegetables if you were consistently food insecure. They were also more likely to use food pantries or food banks. Again, very similar to the data that Mariana presented. In terms of these behaviors, there were no statistically significant differences between the newly food insecure and those who were food secure participants. Then we also had some qualitative interviews that Aida, again, is going to discuss a little bit more. But we interviewed 81 participants, and we were trying to have equal numbers of participants in the three different groups. Again, allowing us to compare some of their answers. But what's interesting is that there really weren't that many differences. Even those who were food secure answered some of the questions very similarly. For example, this point at the very bullet at the end, like use of food pantries. Even food secure folks were using food pantries during the pandemic. People were purchasing more shelf-stable foods. Even though all of them were doing that, it was more common amongst the food insecure groups. And most interesting for us was that we saw an increase of fruit and vegetable consumption among all the three groups. Even though it was more common amongst the consistently food secure folks, We also noticed that the food insecure folks were increasing their food and vegetable consumption. And when we asked about this, across the board, people said, well, we need to eat more fruits and vegetables, so it will give us less likelihood of becoming infected with COVID-19. So people were really kind of taking to heart that, fruits and vegetables are healthy, so that it's going to protect us against the virus. I thought that was very, very interesting. Next slide. I think this is when Aida, it takes over. All right, Aida, it's yours.
Thank you, Sandra, and thank you to all the panelists and the organizers for having me here, and to all of you guys listening. Thank you for being here. We have 10 minutes. I'm going to try to speed it along. If you have any questions, I'm going to try to leave a few minutes at the end, but please feel free to post a question in that Q&A box. Okay, so I'm going to talk just a little bit more about a specific question in that COVID-19 survey, because we really wanted to see what were the major concerns related to economic and health issues among low-income communities, and were there any protective factors within these communities that were associated with fewer concerns. So Sandra said we did 2 surveys during COVID in the very early of the pandemic, i.e. 3 months in, and we had about 367 participants take the survey, 66% of which were the original cohort of that 400. And then we asked people to take the online survey again in December, and we had 304 participants. And we really wanted to assess the COVID-19 impacts and attitudes, food purchasing, delivery behaviors, cooking and consumption behaviors, overall health. Anybody who took our survey received a $20 Amazon or Walmart gift card of their choice. And so some outcomes of interest were the concerns related to food access, financial stability, housing affordability, medical access, and COVID-19 infection. We did a logistical regression to examine the association of race, ethnicity, and then age, gender, education, having children, income with each of the concerns. Next slide, please. So just to give a little bit background of our demographics, as Casey was saying, in the whole study, the mean age was 47. Ours was just a little bit younger at 43. We had participants who were 18 to 84. Unsurprisingly, a majority were female. We had 57% Hispanic respondents, 28% white, 9% who identified as other, and 6% who identified as Black. Only 33% made $65,000 or higher as their annual household income. So that means about 70% of the population makes $65,000 or less. A quarter would make $25,000 or less, which is nothing in Austin. And especially when you have more than one person living in the house with you. And we see that about 80% of respondents said that they have at least another individual living in the house with them, another adult, and then children living with them. Next slide, please. So this is our question with, we did a lot of data analyses. Due to COVID-19, are you concerned about any of the following in regards to you and your family? The availability of food and the cost of food we combined to categorize as food access. And the next slide will tell you the frequency of all of these things that people checked off. So as you can see, the top 3 concerns were the risk of COVID-19 infection. 81.5% were concerned about that. And the food access and financial stability came at 60%. Next slide, please. So then to see the difference in how certain race, ethnic groups responded to the concern question, we did just a basic chi-square test. And the financial stability, housing, and food access came as statistically significant. And as you can see, the respondents who were identified as Hispanic, 68% of them said the financial stability, food access was a really big concern compared to 46% of white. 31% of Hispanics said housing was a concern compared to 17% of white. We also did some kind of a logistical regression to examine the relationship with each of these concerns, variables, and race. And compared to Latinos, whites had 2.5 times higher odds of not reporting financial and food access concerns, and 2 times higher odds of not reporting housing and affordability concerns. However, these significant kind of go away when you adjust the model for age, gender, education, and income. Next slide, please. So then we wanted to see what was kind of causing these big, if there was any differences, if like race was not it, like what is it? Well, not surprisingly, income was a big factor. So income was inversely associated with concerns related to financial stability, food access, and housing affordability, which makes complete sense. The less money you have, the higher your concerns are for these things. Interestingly enough, it was directly associated with concerns of coronavirus infection. Then we adjusted the model for age, gender, education, children and household, and race. And compared to those with an annual household income who make less than $15,000, those in the highest income bracket had 10 times higher odds of not reporting financial or housing concerns, 3.3 times higher odds of not reporting food access concerns. The highest income bracket had 4.5 higher odds of reporting concerns around the coronavirus infection. And interestingly, we wanted to see who made what, like, you know, how much money did the persons who responded to Hispanic, like what was their household income compared to Black, compared to white, other. And 16% of Hispanic respondents make over $65,000 a year compared to white, who is 63%. So these huge income disparities across racial ethnic groups explain why we see racial and ethnic gaps in the unadjusted model. Next slide, conclusion slide. So even in the predominantly low-income majority and minority urban areas, important differences in what people's major concerns were observed. These differences are patterned by race and ethnicity, but income seems to be the primary determinant of the expressed concerns. And so we should have policy and programmatic interventions to target the most vulnerable. So I did it. So that leaves 3 minutes for questions. Thank you all. And I know somebody had a question about published data, and we can send links to the published articles. That's the only question I see.
Yes, that is also the only question I see. Thank you, Jesse. Yeah, we can definitely share with you some links and access. We have the at least from our team, the data that was presented by Dr. Vandenberg about the various factors that are associated with those 3 different food insecurity groups that was published in a journal called Nutrients earlier this year. And then the 2-in-1 data, a subset of that was recorded, I'm reading the announcement as it's coming, was published in the Journal of Agriculture, Food Systems, and Community Development, with many of the people on this panel as authors on that publication. And I think there's a couple of others that are still under development. So I can shoot that information your way if I can share this email slide. Again, I can't unmute myself while sharing my screen. So there you have it. Are there any other questions? I cannot see the chat while my screen is being shared. So if other people can see those.
I don't see anything, but I think we have like 2 seconds before we have to go to the other stage.
Yeah, I see Mariana's comment that their team is working on publications. Good. I was going to ask you about that offline.
Well, I think we can wrap it up.
Yes, well, thank you so much, everyone, for coming and attending, and we look forward to sharing next steps and just want to stress the importance of community-specific work and how oftentimes these data don't exist for years and years until after a situation occurs. So just want to commend my colleagues at Dell Medical School and other institutions and other presenters throughout this conference for the work that they're doing to try to make sure that our neighbors, friends, family members, and other community members are actually being served by the data that's being collected. So thank you all so much.